Hi guys, tonight we're gonna have another podcast about dentistry, about life, how hard, how easy that, and tonight we're having our dear guest, Dr. Sharma.
Hello, thank you for having me.
Nice to see you, nice to meet you, like kinda personally, not in a white robe or with a mask, just in a freely normal atmosphere. As usual, I can ask the first question. What was wrong with you that you become a dentist?
I question myself every day now.
See? I know.
I actually, some people knew from a very young age they wanted to be a dentist. That's something they wanted to do. They had somebody in the family. I actually had none of that. So my family, they were all in healthcare, medicine, pharmacy.
Right.
So I started college as a pre-med major, went through my sophomore year, still taking the same science classes, all that stuff. And I met a friend whose mom was a dentist, and we were in the same classes, and she's like, well, I'm doing this, you're doing pre-med, I'm gonna be done way before you. I'm like, huh. So one day she invited me into her office, and I spent a day there, and she was a periodontist, so different from general dentistry, but they had a couple of general dentists there too. So after shadowing for a day, I'm like, this is really fun, this is, professional environment. You get to work with your hands. I mean, you're restoring people's smiles. You're reducing people's anxiety, all that stuff. I'm like, this is kind of fun. So from that moment on, I just went over a few more times, and I'm like, yeah, I think this is what I wanted to do. So came home, my parents were like, oh, you switched your path? I'm like, yeah, I did, but it's still in healthcare, so you're fine. And then from there, went to dental school, did a 1-year residency after dental school, and here I am.
But nobody told you at that time, even after 2-3 times when you showed how hard it is, right?
Nobody tells you that.
Exactly.
Yeah.
Exactly. Because I know the dentist, I don't know why, I know the dentist is the most, kind of specific and hardest occupation. I don't know why. But maybe because you working all the time, and everybody working with the patients, but specifically dentistry, it's so hard.
Right.
Do you know, can you tell us, what do you think, why?
I think there's a lot of different factors, right? So, like any job, I think every job is going to be challenging, right? I think dentistry is unique because you're doing procedures on a human being, and majority of the time your patients are awake, right? Yeah. And getting them through the sounds, the noises, the smells, the taste, and just any prior experience that they have that wasn't positive. You're dealing with that from a psychological standpoint first, which actually becomes a bigger challenge than what your procedure is going to be, right? That's something that you start learning after you get out of school. And you start seeing patients, and eventually the dentistry becomes second nature, but it's the other factors that you're looking into that you really learn after you start working.
And obviously some days it's harder than other days. Do you have hard days when you, let's say, coming home and say, oh my God, why did I choose this? Why I see this so many patients?
There's days like that, but you also look at it that, hey, I'm thankful that I get to do this. I got to help somebody out, and even if it was a rough day for myself or the team, we bounce back Monday, there's going to be a good day, right? So
it's going to be Friday.
Exactly. There's always going to be a Friday, and luckily, majority of us are off on weekends, so that's nice.
When you decide you're going to be a dentist, what, let's say, your bachelor degree, where did you get bachelor degree before the dentistry?
So I knew I wanted to do something in healthcare. Like I said, I was pre-med, pre-pharmacy.
You don't have a choice. You know it's going to be.
I knew I wanted to go to college. I wanted to help people out. I liked science, so I knew I was going to go into one of those professions. Luckily, I met that friend, and her mom was kind enough to invite me into her office and kind of show me around. And I kind of fell in love with it. I was like, this is really nice. I get to work with my hands and help people at the same time. So for me, I think it was like a good combination.
And what school did you go?
I went to University of Illinois in Chicago. So very local.
Very local, Because I know in that school it's so hard to get in.
It is a competitive school,
Yeah, because Northwestern closed, Loyola closed.
Yeah.
We have only two, UAC and Midwestern, right?
Yeah, and Midwestern was very new when I
Very
started
new.
at
Yeah,
UAC.
you're
It
right.
was
Yeah.
maybe a couple years old.
Well, how was it, hard or not hard for you to study, to finish it?
You know, I think once you get something started, you're going to finish if you have the right mindset. And I'm not going to lie to you and say it was easy.
Yeah.
There were definitely days, weeks, months. It was hard. And to your question earlier,
Yeah.
I questioned myself all the time. Why did I do this? But there were good days too, right? And there were good times and the excitement, right? When you're
Exactly,
learning
yeah,
something
yeah.
new, when you get from preclinical, working on sim lab, and then you finally walk into clinic and you actually work on a human being.
Uh-huh.
I mean, that's the greatest day, right? I mean, every student that walked out of that first patient daycare was, you know, stellar, right? Like, oh my God,
Yeah.
look what I did. You know, even if it was simple as like, I cleaned somebody's teeth. I just placed a simple filling.
Right, yeah.
It's an exciting moment.
Do you remember your first patient? Because usually first patients, when you almost finish the school, you start to see the patients, right?
Mm-hmm.
Do you remember your first experience?
Yes, my first patient was a denture try-in, or
Wow.
well, doing the wax rim try-in.
The hardest one.
Yes.
I
And I remember I was there with my instructor for about 3 hours
Uh-huh.
trying to get a bite.
Wow.
Yeah, you know, wax off, wax on, wax on.
Wow.
That's what it became. And
Yeah.
you know, in school, they're so particular about how
Yeah.
you do it and follow all the steps and rules and everything like that. So, yeah, it was a little daunting, but you know, we got it done, and then
Yeah,
the
no.
denture fit great eventually.
Yeah, yeah. But in your practice, I mean, after that, you have to do more and more and more and more and more. But you need the more experience, especially when you do removable, right? Because I mean, crowns is crown. I know it's hard too, but removable is specific part when. First of all, mostly older people,
Mhm.
older elderly people, and second of all, you need to know so much anatomy to do everything right,
Right.
right? How was it for you, like when you already start working?
So it still presented itself
Yeah.
with the same challenges,
Yeah.
right? And at least in my experience, I don't know how other dentists feel, but more than just the clinical aspect of it, it's really dialing in the patient's expectations, right?
Mhm.
I tell my patients, I'm like, you're 60 years old, 70 years old, you've gone a lifetime chewing with your own teeth, you never think twice if you're biting into a peanut
Yeah.
or pasta.
That's it.
Now I'm going to create something, I'm going to take something God made, and now I'm going to create it and try to mimic that to function for cosmetics,
Wow. It's,
eating, chewing, learning how to talk. I mean, you're basically breaking in a new pair of shoes, right?
It's
and
a very good point.
learning how to ride this bike, and now
Yeah.
you're doing it at the age of 60, 70, 80 years old. So really dialing in on the patient's expectations, I think, is the most challenging thing.
Yeah, because it's actually I just when you're talking about it, I said, oh my God, it's true because like we mostly do all the next cases, kind of big cases, and so many times the patient kind of complain, you know what, a little bit there, no, I don't feel exactly the same, and it's I mean, for me it's hard to say it's not your teeth anymore, it's
Yeah.
not your real teeth. We create it,
Yeah.
and we think it's right, maybe not right, but it's impossible. You're never gonna have exactly the same smile or exactly the same teeth what you got before.
Exactly.
And for patients, so hard to understand because they think, oh, it's it. It's we put the car in your own mouth and it's finished.
Yeah.
But it's hard, yeah.
Yeah.
And it's exactly what you said. It's before you can eat peanuts or you can crack ice. It's it. It's gone.
Yeah.
Huh. Wow.
100%.
You become a general dentist. Why do you want to go more, like to have more, let's say, prosthodontist, periodontist, endodontist, or oral surgeon, for example? Or was too much?
So after 4 years of undergrad and
Mhm.
dental school, I was
Exactly.
like, I feel like I've done enough school. And there was never one specialty that just stood out like,
Yeah.
I want to do this and only this for the rest of my life. I instead enjoyed a little bit of everything,
Mhm.
and I went out and I did a 1-year residency after dental school, which basically is a hospital-based residency, and you get a lot of exposure to patients of, you know, medical compromise, special needs, different dental needs that they need, and you get exposure to every single field. So from there, you know, you gain a lot of exposure, and we find that, you know, we don't always need the specialist. You always need the specialist.
Well, yeah.
But, you know, for routine stuff, you know, we can take teeth out, we can graft, we can place implants, we can see pediatric patients, we can do removable, we can do a little bit of orthodontics. But the nice thing is about being a general practitioner is when you know that there's a case that's a little bit more difficult, maybe would be best suited in somebody else's hands, it's very easy to pick up that referral pad
You're right.
and have them go to the person that's doing just that 9 to 5 every day.
Yeah. In your practice, you're doing everything, right? I mean, removable, crowns, fillings, like you said, right?
Pretty much doing everything in-house,
everything.
yeah.
That's cool. But it wasn't like that, like, let's say, 20 years ago, right? Because I remember, like, years ago, general dentists can do, let's say, filling, sometimes crowns, cleaning. Now, with probably with technology, you can do now everything, right?
Yeah.
Mostly.
Yeah, 100%. And I think, when implants first came around, it almost had like a dogma around it that it was, hey, this is a oral surgery thing.
Yeah, you're right.
And they were still figuring things out. And as time has gone on, I mean, now I see endodontists placing implants, so it's just a matter of time. It's a matter of education, availability, right? So now there's so many different curriculums, and schools even as dental students are learning how to place implants and learning the restorative side. So I think whether or not you do it, it's really important to understand the fundamentals of both sides. Whether you're a surgeon or a restorative doctor, you need to know where you're going to place that implant, and you got to know what the final outcome is. So always start with the final outcome before you start the surgery.
In your practice, probably you got some crazy cases, some funny cases, but crazy case nobody care, but funny. Let's just for example, like we got years ago the case when we put wax trains in the mouth, upper lower. The doctor forgot to tell the patient to change it, and patient went home.
Okay.
It was probably cold outside, but he started drinking coffee, and the teeth start come out.
Oh, jeez.
And the patient freak out.
Yeah.
And I mean, we're laughing now. I can imagine patient face when. But did you have any kind of freaky, funny situations like that? Like maybe some funny cases, funny patients. Usually, right?
Yeah, it's hard to pinpoint on one now.
Yeah.
I have a funny story if you're looking for something funny.
Yeah.
So it didn't happen to me personally, but this is actually a story from when I was in dental school. It was a classmate of mine. It was his first gold crown that he was putting on a patient. He was super excited. Patient was super nice. Because gold it's a lost art now. Nobody really does gold onlays and lays and crowns anymore. So prepped everything, and it was the day of delivery. So patient comes in, student is excited, patient's obviously excited. Well, during the insertion, the patient swallows the crown, which was a big no-no in dental school, right? Because they're preaching the safety and the precautions and all that good stuff. Well, funny story, patient went home. He brought that crown back. Yeah. They sterilized it, and a week later he put it back in his mouth.
Cool. This is so good. See, because gold, it's gold.
Gold is gold.
I still have couple inlays. Years and still. Gold is gold. Nothing to say. Yeah. I remember all time when back in Ukraine when we did the crowns, people didn't have money, but gold was gold. It's mean we did front teeth. Probably never said it, right? Front gold teeth.
I've seen a couple of cases come in. Yeah, I've seen a couple of cases come in. Maybe it's like a single
central or
sometimes
something. Even 6, but it should be gold because it means people show you they have money.
Yeah.
Can you imagine? Yeah, but let's go next. That's behind the dentistry. What else do you have? I mean, dentistry it's a big hobby. But after you finish work, you come home, your vacation. What you like? What you hobby? What you like behind the dentistry?
When I come home, I love to enjoy spending time with my wife, my family. I'm Indian, so our Indian families become very big, even our friends become family. So there's always something, right? Somebody's getting married, somebody's, getting a baby shower or whatever, So there's always a lot of these events that, always looking forward to going to. I love eating. So,
do you cook?
I cook a little bit. I'm not the greatest cook. I'm not going to make that my career.
But who cooking in your family? It's me and your wife.
We split.
Really?
I do a little bit more, especially with like meats and stuff like that. So I think with like the TikToks and Instagrams,
you find so much.
You find so much, and it's like, I'm going to save this. I'm going to try to replicate. I don't always do the same, but we make it work. It tastes good, and love traveling. Anytime I can, I rather spend my money on traveling and getting a new experience, seeing how the other part of the world lives. So that's always nice.
But do you have any favorite like country when you, let's say, okay, you came to this country and I'm gonna come back again, for example?
Yeah. So my friends and I, we recently went to Costa Rica earlier this year. It was his birthday. He was getting married. We did some zip lining out there, ATVing, and it's actually one of the blue zones of the world. So
See, everybody's saying that. Yeah.
people are very healthy out there,
Uh-huh.
and just very laid back,
Really?
and the weather's perfect. So a lot of outdoor stuff to do. So I would definitely go
again.
there. But before I go back and revisit something I've already gone to, my wife and I talk about going to Japan, going to Italy, Greece, and all that.
So
just
many
basically
places to go.
explore. Exactly, the world is huge.
I always was interested, but you told me you're Indian. Like, let's say when we're gonna, Europeans from Ukraine, when we have a wedding, when we have, let's say, 150 people, 200, say, oh, we know it's so much, it's killer. But I know you guys have huge weddings, right?
Yes, we do.
Because we were invited, we didn't go, we couldn't go, but we were invited, our friends, they make a wedding in New York, but it was already 600 people.
Wow.
Yeah, Indian.
I believe
yeah.
it. I believe it.
Really?
Yeah.
Do you know why it's a tradition?
It's tradition. I think Indian families in general are very hospitable, right?
Yeah.
And we want to share, occasions of joy with everyone. It shouldn't be like bottled in or close family. We want to share that with everyone. So, when you're getting married, it's your friends,
Right.
your family, and then it becomes like my parents' friends and
Yeah.
their friends. So I think when I got married a few years back, I think ours was close to 400. My sister's getting married at the end of the
Really?
year, and hers it's probably going to be around like 350, 400 people as well.
But do you need like a place to put so many people?
Well, luckily, most people are local, and at least in my wedding, my wife's family is from California. So majority of her family flew in, but we had already made the proper accommodations. Like, hey, this is where we're getting married. This is the hotel you want to be at, and things like that. So, and our weddings, with all the celebration, it's like a week long.
I know, it is,
festivity.
yeah.
So it's a great time.
It's
It's
like
a
a
great
fest.
party. Yeah, it's a great party.
Cool. Yeah, I mean it's unbelievable. No, because I saw this, and every time I think it's a probably culture because I know so many people. And when we did weddings, our weddings like 150, 200. Oh my God, how are we gonna do it? So many people. And when they invite us, and I knew it's 600 people, I said, it's nothing. 150 people, it's nothing.
Yeah,
I know. You like to travel. Do you like gadgets?
gadgets as
Gadgets like I mean, phone is phone, but do you have anything? Can you imagine you without the phone?
No, I feel like recently it's the phone. I do everything off my phone.
That's it.
I
Everything.
feel like I pull out my laptop maybe 3-4 times a year. I mean,
That's
I
it.
pay my bills off the phone. I check my emails off the phone. Call, text, obviously. Social media is there. My games are on there.
That's mean
The phone's a lifeline now.
It's only stuff which you can't live without is the phone.
Yeah.
And I am screaming at my kids.
Yeah. See,
I
when I
have
was
to-
growing
have
up,
to
it was
stop.
a TV.
It was
That's all we had.
Yeah.
But now, I mean, your phone has everything.
Yeah, and it's kind of okay. Let's talk about technology in dentistry. Can I ask you how many years ago you finished school, like a dental school?
So I finished up dental school in 2018, and then
Okay, so
I
yeah.
finished up my residency in 2019.
It's
So
already like 8 years.
8 years now.
What changed, like digital? What changed in dentistry? What you can see, it's going so fast.
So a lot of these things were already out there when I was
Oh,
in
yeah?
school or finishing up. So digital scanners and everything like that. I don't know if you remember the older ones. E4D, Plan Mecca, and stuff like that was out there. We didn't get a ton of exposure because it was still kind of newer, and not all the facilities had all this stuff. But obviously, with digital scanners now, I mean, they're the workhorse of the practice, right? We're scanning them for removable, fixed. I mean, clear aligners, everything. Intraoral cameras, obviously, very helpful.
Yeah.
And now with AI, still kind of on the fence with it. I think it's going through some learning curves, but I think more so than the dentist or the clinician. I think it's a good patient tool where, I always tell patients, I'm really good at reading a black and white x-ray in 2026, but for you, let me turn on these colors. So, and it separates. It's like, hey, this is the enamel, this is the nerve, this is the decay, this is the infection. So when I think you illustrate these things to the patient and they can visually see it,
they understand
in terms that they can understand. I think it makes a lot more sense. I think they feel more comfortable with the treatment plan that they're accepting, versus just looking at a black and white film.
When you working, do you like to listen music? And what kind of music do you like?
I do like to listen to music because sometimes, especially during close to lunchtime, I don't want the patient hearing my stomach. But the office has the music on all over. So we get a new DJ every day. So one of the persons at the front desk will turn on their, Spotify station. So as long as there's music on and it's perfect, it's going, it's all good.
Indian food, but do you have any specific cuisines, like food, what you like?
Oh man, we could be here all day if we started talking
Really?
about Indian food. Yeah, I love Indian food. I think the staple, where majority of Americans probably will recognize, butter chicken, right?
Yeah.
That's a staple. You gotta go for that. But chicken biryani, it's basically a mixture of spiced rice with chicken. You could get it with lamb, you could get it with beef. And India is the one cuisine where you could get a ton of vegetarian food. And it's delicious. You don't need the meat. So there's a lot. And we're fortunate enough to live in Chicago. We have a lot of Indian, restaurants and places
Can
to
you
eat.
recommend it, let's say our area, whatever, north side, which one? Let's say we can go. Which one?
So around here, there's something called Hyderabad House. There's the location in Schaumburg, and they have one in Buffalo Grove.
Oh, okay.
That's a really good place.
Really good place.
And with India, depending on which region you're in, the food changes, right?
Food,
There's similarities, but there's also a lot of changes. So North Indian food, South Indian food. So there's a lot of variety. You could eat Indian food every single day for a month and not eat the same thing twice.
Wow.
Yeah.
Really?
Yeah.
We should try, guys. We're gonna go.
Yeah. I'll take you out one day.
That's it. We're gonna go. But it's usually spicy or not.
So we like spicy. I like spicy. But no, when you go out, they'll make it to what you want.
Accommodate you.
It's very flavorful. I'll tell you that. Lots of spices, and when I say spices, not just like, hey, it's spicy, but
it's just
for flavor.
For flavor, yeah. Okay, we're gonna try it. Let's say, do you have any animals? Do you like animals?
I do. I have a 6-year-old golden doodle.
Cool.
Yeah, he is our firstborn son.
That's
what we refer to.
I can imagine when they're gonna come home. Usually when coming home, he just all over.
He's so excited, and he hates when you leave the house. He knows. Anytime you have bags packed or anything like that, he goes and stands in a corner. He's sad. He's like, for him, we're everything, and it's what it is. But he's our life.
Let's say, what kind of advice you can give to our, let's say, patients to keep their teeth healthy? I know every time I think when we came from, everything was kind of bad in dentistry too. It's mean when we came here, all our teeth was already done. But here, my kids go, true, if I go to the dentist, I'm sweating. I just, if I love you now, but if I'm gonna sit in your chair, I'm gonna hate you. But let's say my kids, they go to the dentist nothing happened.
Yeah.
That means it's a culture. That means they start from little and go. That means all my kids beautiful teeth. It's mean why? Because they start from the beginning.
Yep.
Any advice for kids, for adults, how to keep their teeth beautiful and healthy?
Yeah, it's just regular maintenance, right? Don't go when there's a problem.
Usually.
Go routinely, right? So hopefully if there is a problem, you can catch it quick, right? Same thing, you don't want to wait till your car breaks down on the side of the road before you get it checked out. Go in for your tune-ups, your oil changes and things like that. So, aside from just normal brushing, flossing, going in, getting your regular cleanings and, watching what you're eating, not sugar right before bed, But I think those early visits are good for two reasons. One, you're getting the, cleanings and the attention and the exams done, so if there is going to be a problem, you can catch it quick. But B, I think from a psychological standpoint, the last time you want to bring, especially a kid, to the dentist is when there is a problem.
Exactly.
Right?
Yeah.
Because then there's
Yeah.
going to be a needle involved, there might be drilling
Yeah.
involved. So you don't want to set it up for a negative experience. Because after they leave there, anytime you talk about the dentist, that's what's going to go on their mind. And unfortunately, we see this a lot with adults that have a lot of dental needs. They're carrying their past traumatic dental experiences from childhood into adulthood,
Yeah.
and that prevents them from seeking the help that they need.
Yeah, it's exactly right. I'm going to the dentist, and when I just start feeling, I start feeling I'm going, but it's already too late. Root canal or whatever. I know, but yeah, I know it's psychological, and you have to do this like from the age when you. Let's talk about the braces. Like, what do you think about braces or Invisalign? What do you think, in your opinion? I know it's kind of similar, but Invisalign, I think it's better but I see still a lot of kids and adults, they're wearing just regular braces. What do you think?
So I think there's a time and place for both, right?
Oh, yeah?
There are some cases that are just too complex for clear aligners, whether it's Invisalign, SureSmile, whatever.
Yeah.
And I think you do have to just do conventional braces. I think it's case dependent, and I think now, again, technology changes by the week, right? So I think clear aligners are able to do a lot more today than they were 10 years ago. That being said, I think with clear aligners, it involves a lot of patient compliance, right? With the brackets and braces, you can't remove them at home, right? The teeth are going to keep moving, they're going to progress the way they should be. Versus the aligners work by, you got to wear them for about 22 hours a day. Well, teenagers, right? That's a tough age, right? So they don't wear it, well, treatment's not going to happen. So I think that's where you really have to consider patient compliance, their attitude and motivation towards achieving the results that they want.
And on a note, we're gonna finish. Any advice for, let's say, younger generation when they decide to go to the dentistry? What do you think?
I would say, and I wish I had done this for myself, I would say get a job in a dental office.
Wow.
Yeah, don't just shadow and watch and things like that, which is good. You should do that. You should see what you're signing yourself up to. But I think exposure, if you work in a dental office, work as an assistant, learn how to clean instruments, learn how to, set up and break down rooms, work at the front desk, learn customer service, how to answer the phone call, and learn insurance, right? Because that kind of stuff, I'm going to be honest, I know nothing about it. I have to rely on my, colleagues, my coworkers, my staff.
Yeah.
I'm like, I tell patients, I'm like, I know what I'm doing in here, but when you step outside, they're the professionals. I know nothing, So personally, I wish I had a better understanding of how that kind of stuff, at least for the business, worked out before I went in.
Okay. We're going to finish on this note, and I hope we're going to invite Dr. Sharma more. And maybe we're going to talk nothing about dentistry, maybe about travel, right?
Yeah, let's do that.
Thank you for stopping by.
Thank you for
I
having me.
really appreciate it.
Yeah.
And we'll see you guys soon.